Good day, everybody. Assalamu alaikum, and thank you for listening to my presentation. My name is Ismat, and I'll be presenting to you on a small research that I did for my PhD, which is a component of a larger topic to detect and expand medical abbreviations using state-of-the-art technique. So this research will only talk about what we find in our Malaysian clinical notes, and we entitled it as short and ambiguous, which is medical abbreviations in our discharge summaries. We will begin our presentation as the motivation for this study, as well as some justification, and end with the discussion and conclusion. Well, why medical abbreviations are important. What we find in our study through literature research is that medical abbreviations in clinical notes, and especially electronic clinical notes, has been studied all over the world. A recent study in the Malaysian context is a survey by Ko et al. In 2017 or 2015, sorry. And this study is quite alarming because from the survey they find that 13 to 17% of the doctors and nurses actually acknowledge that they had faced in delayed when administering medications, performing procedures, and making diagnosis because they have misinterpreted or have difficulty interpreting the abbreviations in the clinical notes. 12% actually acknowledged they did make the wrong diagnosis, while 9% actually gave a wrong therapy. And this situation is not actually different from those in other countries, especially those which uses English as a medium to document their clinical notes. Which leads to how common are actually medical abbreviations in electronic clinical notes. Has it been any different from those which use manual documentation? Well, the study in Australian notes by Holfer et al. In 2019, which is very recent, found that 8.9% of the tokens or the words in their clinical notes are actually abbreviations, and 1/3 of those abbreviations are ambiguous. And let me explain to you what ambiguous means. Ambiguous is when one in this context, one abbreviation can mean several things, and you know this is very common in medical field, especially when we share the same abbreviations across multiple disciplines. An example I can give is SVD. So SVD is very common. If you go to the cardiology clinics or ward, you would automatically know that it is single vessel disease. But if you are an obstetrician, you probably think that is a spontaneous vertex delivery, or it could also be a spontaneous vaginal delivery. So that one abbreviation SVD actually have three possible meanings here, and it could be more if we dig further. But that's an example of an abbreviation that is ambiguous. Abbreviations in American medical notes. There's a study in 2018 as well, where they found 5 to 9% of the tokens are abbreviations, and almost a quarter of it were ambiguous. So before we proceed to create a clinical decision support system or a technique to detect and expand abbreviations automatically in electronic clinical notes, we need to understand what is the landscape on the use of abbreviations in Malaysia. So this is the presentation today. Other than that, we will also share with you the features of abbreviation. And these features of abbreviations is quite important when it comes to creating a system to detect abbreviations. So previously, how do you handle abbreviations can be done by manual approach. What it means by manual approach is that you have an approved list. Somebody actually created a list of an abbreviation that can and cannot be used. The problem with this is if one discipline can use the abbreviation that they want, the rest has to compromise. It requires training and auditing to make sure that people adhere to your list. And as you know, sometimes your junior officers or even your senior officers create abbreviations once a day. So in the end, as time passes, you need to have a periodic update to your list. And this is usually occur in abbreviations related to prescriptions, because there were many studies on the safety and quality of patient care. There is potential harm when it comes to using abbreviations and misinterpretation of abbreviations in writing prescriptions. So a lot of this approved list or creating this manual approach is usually for those in the prescription. But we know that as clinical notes, electronic is easier to share clinical notes between multiple disciplines. And in fact, you want to refer is easier when you want to refer to a primary care clinic or to another discipline, or even primary care clinic to a hospital. So there has been suggestion to use automated approach to complement this, and this is where features of abbreviations we believe can help those systems to improve on how to detect and possibly in future expand it automatically. So that's the two objectives of this research. The first is to find out the use of abbreviations in Malaysian medical notes, particularly the cardiology and discharge summaries, and number two is the features of the abbreviations. Well, what we did was we extracted electronic discharge notes from a centralized system in Malaysia called MyHDW. And in this Malaysian Health Data Warehouse, one of the data is electronic clinical notes written by doctors from hospitals with electronic clinical records. And at the time of extraction, we actually managed to extract discharge summaries from a private hospital and one public hospital. And this is good for our study because we can actually learn how one differs or if there's any similarity. So it is regularly in Malaysian practice that the juniors or those doctors who are house officers who are still in training to get their medical license are tasked, are responsible for the documentation. So we can assume that discharge summaries from the public hospitals are documented by junior doctors. On the other hand, documentation at private hospitals are usually by senior doctors who are more experienced. They are hired when the doctors are certified. Usually they are already specialists and also can be a consultant level. So they are more seniors, and that is the assumption for this study. There are multiple specialty in the discharge summaries, but the most predominant one are cardiology and general medicine, and that is what we extracted for this study. From the electronic discharge summary that we extracted, we actually conducted manual annotation. So the electronic clinical notes that we extracted, we grouped it into three types: cardiology notes by senior doctors, cardiology notes by junior doctors, and lastly, general medicine notes by junior doctors. The manual annotation refers to the general method of annotation by Stubbs in 2012. It goes through the 4 stages. The main thing I want to highlight here is that the annotators are tasked with 2 things. The first one is to find any abbreviations in the text and highlighted using a tool, annotation tool called BRAT, B-R-A-T. Number 2 is once they tag the abbreviations, they are required to give the extension of that abbreviation based on the context that they see or they read in the clinical notes, what they understand from the clinical notes. And at the end of the annotation, if there is any discrepancy or any, since the annotation is done independently by at least two annotators working on a single note, if there's any discrepancy, then an adjudicator with a more than 5 years clinical experience will come and look at the annotation and select which one is the right one. And the data analysis is basically the quantitative and qualitative. The descriptive analysis look at the sum, mean, standard abbreviation, and median of the tokens, abbreviations, and ambiguous abbreviations. Whereas the content analysis looks into the formation of the word or the formation of the abbreviations, which will be the features of those abbreviations. Well, in all, in total, we looked at 1,102 discharge summaries, which contain about 180,000 tokens or words. This could be more because sometimes a token can be a symbol as well. Out of that, 33,824 of the tokens are abbreviations. And it will be shown in the next page that out of those abbreviations, 7,640 were ambiguous. So that's 23% of the abbreviations. We can also see that when we compare based on groups, we find that the junior doctors tend to write longer, both from in the general medicine as well as in the cardiology notes, almost more than twice or even triple the notes written by the senior doctors. And secondly, junior doctors tend to use the abbreviations more frequently, much more frequently. So this is an interesting finding which we can actually made aware of our junior doctors later on. When we look at the ambiguous abbreviations, we find that there can be up to 7 senses for one abbreviation, and that is in our study PV, which can mean per vaginal, peripheral disease, peripheral volume, premature ventricular, and so forth. So we can see that as the different disciplines combine together, the abbreviation becomes more ambiguous, and which also imply that if you start to reuse clinical notes from one discipline to another, or for example refer one clinical note using an abbreviation to another discipline, that's where the problem can occur, because one discipline can use the same abbreviation with a totally different meaning, and it can cause miscommunication, misinterpretation, misdiagnosis, and even mistreatment. I want to talk about the features that we find in the abbreviations that we've elicited. We actually elicited 11. Number 1, 2, 3, truncation, contraction, and acronyms are very common, and this is widely known. But an example that we find is, for example, for truncation, CA for cancer, it can be calcium. Strep can mean streptokinase and streptococcus. So truncation occur when the first few letters represent the entire abbreviation. Contraction occurs when the letters some of the letters in between are missing, and these are usually vowels. Whereas acronym are the first letter is usually represent the words in the phrase. For example, IHD for ischemic heart disease, LP for liver profile and lipid profile, and so forth. We look into character length. We have one that is up to 11 characters, and this 11 character is actually a truncation. Most of the abbreviations are ranges between 2 to 3 characters. We also should look into the use of symbols and numbers. So if there is symbols and numbers inside the word, it may indicate that it is an abbreviation. For example, D1. So some people might use it to mean day one, but it can also be first diagonal branch artery, which is commonly used in cardiology. And sometimes they use the number 2 plus for calcium, and so forth. And then we also should look into the period character. Where does the period character, the abbreviations that with a period in between or immediately after could be an abbreviation. So for example, T dot can mean tablet, can mean total, but if you see the use of period character in between two characters without space, then it could potentially be an abbreviation, for example, on examination. X character is also commonly used. X character is sometimes used to replace the whole word or letters of the original word. For example, DX for diagnosis, MX for management maybe. But the X can also be in front, for example, XR for extended release. So the use of X in abbreviation can also signify that it is an abbreviation. Plurality. So one of the things that we, for an abbreviation, that needs to, when you create a system to detect abbreviation, must look into this closely, which is the use of the letter S at the end. It may mean that it is indicate a plurality rather than it is a part of the abbreviation. Number 9, we also need to look into English words that is disguised as abbreviations. So cap, wear something that you wear on a hat, can actually mean a community-acquired pneumonia. On, something that you put on top of something, can actually mean omne nocte, or when you prescribe medication to be taken at night. Yeah. AT can mean atrial tachycardia. So it doesn't mean that if it occurs in English word that occurs in a English dictionary, it may be an abbreviation as well. So because there's one study that looks into detecting abbreviations where if the word is not in an English dictionary, then they will highlight it as an abbreviation. So there are, in our case, in medical notes, there are cases where an English word that is in the dictionary can be an abbreviation. Number 10, we should look into the position of the word before and after. So it may indicate whether that is an abbreviation or not. Yeah? And lastly, we should look into the root word, whether the word is a noun or adjective. So this is very important when you want to not only detect but also expand, especially when you expand the word. Should you say ABD as abdomen, or should we say that ABD as abdominal? LA left atrium or left atrial? So those kind of expansion later on, once you detect it, may actually give uh, an indication whether your expansion is correct or not. So those are the 11 features of abbreviations that we elicited from this study. So there are these four main points actually I want to discuss. We now know the landscape on the use of abbreviations in our Malaysian clinical notes, especially the discharge summaries in cardiology and general medicine discipline. It is very common. 14 to 27% of the tokens are abbreviations, and 24% of it were ambiguous. 24% of the abbreviations are ambiguous. That's what I meant. And we also learned that junior doctors tend to write longer, uses more abbreviation. It may be helpful for us to increase awareness among doctors because in the study by Koh et al., the survey finds that the doctors feel when they use the abbreviation, everyone else should know what it means. So that's the wrong concept. And the study also find that the junior doctors tend to copy or learn from their colleagues and their seniors. So as you can see, the reason why the abbreviations are getting bigger and more common is because of this learning from their seniors. So if we want to tackle this, I think we need to increase awareness and allow them to learn that especially when they write prescription, to be careful, especially when the clinical notes are being shared, especially like discharge notes, referral notes are being shared across multiple disciplines and other institutions. Try to limit or even not use abbreviations at all. And again, the same point, we know that abbreviations become more ambiguous and as more disciplines are combined. So particularly when maybe they want, it is possible to make a regulation rather at the hospital level, institution level, or even at state level, that when using shared clinical notes, abbreviation should not be used. Lastly, the 11 features of the abbreviations that we have elicited hopefully will be helpful in further research, further study to detect abbreviations and expand them automatically. So with that is my final conclusion. On short and ambiguous medical abbreviations in cardiology discharge summaries. If you have any question, you may contact me through email or LinkedIn and share your thoughts in this research. Thank you very much. Assalamualaikum.